So this was a retrospective review of a single institution. We used Ixazomib in combination with Lenalidomide and dexamethasone for patients with relapsed multiple myeloma who'd had at least 2 prior lines of therapy. We've treated approximately 30 people in the abstract presentation, and we looked at the demographics, their response rates and their progression-free survival. Essentially, our results very much correlate with the tourmaline MM1 clinical trials dataset. The response rates were incredibly high with nice CR rates. And also what we found was the progression-free survival was comparable, i.e. in the region of 20 months for all patients. We then performed a subgroup analysis of these patients, and in the real world we do tend to treat a slightly different dataset compared to those that take part in the clinical trial. And what we found was that those patients that were refractory to proteasome inhibitors didn't do quite so well as those that were sensitive. This really goes in keeping with the tourmaline trial, where they excluded such patients. So the PI refractory patients had a much shorter duration of response compared to those that were sensitive. Additionally, we found that those with a 17p deletion did not fare so well. However, the numbers of patients in this dataset were fairly low, so we can't make conclusive evidence for this. Finally, I should say that we looked at the addition of Ixazomib to those patients that were refractory to Lenalidomide. Again, these are small numbers and you can't draw firm conclusions. Some patients derived benefit, but most patients didn't, which again supports the notion that if you're treating people with the IRD regimen, you really need to be combining all 3 agents up front, rather than saving Ixazomib to those that don't respond optimally.